Hi, this is Marika from Herasphere, and what I want to talk about are some of the misbeliefs that are out there in regards to the management of diastasis recti. I think it's really important that we all, as health and fitness professionals, just acknowledge that we're all exposed to bias when it comes to treating anything, really. But certainly when it comes to diastasis recti, we're all influenced by what we read online, and in books, in articles, and in particular, our interpretation of research articles. We will often search out for articles that confirm our bias as well. And we are often sort of, I guess, biased towards listening to therapists who we respect and admire, and who obviously have opinions that sit alongside what we believe. So I think we really need to have an open mind when it comes to diastasis, because I do think there's so much that we don't know about it, and we're on a big learning curve here. So one of the first beliefs I want to disprove really is diastasis is bad. It's like really bad. It's really dysfunctional. And I know that many of you have read some of the research that's shown that, women in their final trimester, 100% of them will have some degree of diastasis. And, that research, that was only 16 millimeters. So that's pretty tidgy. That's a pretty small gap. But the reality is everyone pretty much has a diastasis in the final trimester of pregnancy. It's part of growing a baby. It's a normal thing. I don't like pregnant women to focus too much on diastasis. And certainly postnatally, if we know that something like 2/3 of women heal naturally within, a few months of having their baby, again, it's not a death sentence. And we know as physiotherapists clinically that a lot of women actually, even if they do have significant diastasis, will actually do really well with a structured exercise program. So is it really bad? Is it evil? Is it horrible? Is it the worst thing in the world? Probably not. Another misbelief is if you do the wrong exercises in pregnancy, you're going to get diastasis. This is one I hear a lot. I've heard lately you shouldn't do lat pull downs. Definitely no crunches or planks. You shouldn't do any kind of pushing overhead if you're pregnant. Again, do we have research that actually shows that those exercises in particular will cause diastasis? We don't. We don't have research where they've taken women and given one set this particular exercises, and these ones the exact same exercises but chucked in some crunches and seen what's happened. We do have these, I guess we have these extrapolations, these thoughts that anything that can cause bulging in the linea alba is probably not good. And certainly if I see women doing exercises where I see that doming, I will advise that that's probably not the best idea. But we don't really know a lot about what actually causes diastasis in terms of exercise in pregnancy. So I think we need to be very careful about making those assumptions. This is one that I hear a lot in the postnatal population and certainly online. This technique worked for me, therefore it will work for you, for everyone. And as much as I love that there's so much support online and people trying to help each other out and give their personal experiences, which can be very valuable, I do think we need to be a little bit careful about saying like this particular set of exercises will absolutely help you because it helped me, or I healed my own diastasis, so I'm going to create a program and put it out there for everyone to do because it is the best thing. We need to treat people as individuals because everybody responds differently to rehab. So I don't believe that one technique will work for everybody. And just as an extension of that, this is something that I need to look out for, is that there is that temptation to say as a health and fitness professional, this client got better because of my exercise program. Therefore, it was my awesome exercise program that helped them. And I run postnatal exercise classes, and, the vast majority of my clients do really, really well with structured exercise. So it'd be so tempting for me to say, oh yeah, my program is the best and it heals diastasis. But can I really say that? Or is it that it's just time and natural healing? Is it that general exercise would have helped them anyway and there was nothing in particular about those exercises that made them special? Is it, my personality and the fun and joy that I try and bring into my classes, and the fact that it's social and they get to do things with their babies, and maybe there's some of that other stuff which helped with healing? I don't know. And I think I need to be careful that I don't state that it was those particular exercises which had that effect, because I don't know for sure. Here's a common one, especially in the postnatal groups, but definitely in pregnancy as well. Crunches will make the diastasis worse. You should always do pelvic floor and transversus abdominis exercises to close the gap. This is certainly a belief that's been around for a while, and certainly what I was taught at university. We don't know this for sure. There are physiotherapists currently actually looking at using exercise programs which involve crunches from literally in hospital to heal diastasis, and they by all accounts are having a really positive effect on women. So maybe crunches are actually part of the solution rather than necessarily a part of the problem. When we look at transversus abdominis as well, what does it do? It actually pulls the gap apart. It creates tension in the gap, and that might be part of the healing process. Does it close the gap? Probably not. So we need to just be keeping an open mind with our thoughts on crunches and transversus abdominis and what those influences on postnatal recovery will be. So what do we know? What do we know? We know a little bit. We know some facts about, you know, who's more likely to get diastasis, but there's a heck of a lot we don't know about what actually causes it. My gut feeling is that tissue integrity, so genetics, are a huge component. These are my bias and these are my beliefs, but I believe that, you know, genetics have a huge component, and I believe that load also has a huge influence on diastasis. So too much load and not enough load are probably going to both be detrimental, and we need to be somewhere in that middle Goldilocks zone where we're getting nice structured load through the linea alba during its healing process to enable for it to lay down connective tissue along the lines of force. Anyway, they are some of the beliefs that I've seen out there. I'd love to hear some of yours. Please feel free to post them in the link below.